I think there's been some regression to the mean. So I think there was this huge escalation in volumes, and we knew that there would be a retraction. If you're a direct to consumer care provider or you're in a health system, you've seen that pullback. I still think what um, kind of the state of virtual care is that there's an expectation that you're going to be able to provide a connection to a patient. If you're just providing episodic care, and there's still plenty of it that's out there, it's kind of, one and done. That's hard to be able to trust. And it sometimes gives, I still think, virtual care a bad name. There's this expectation of, hey, and it's oftentimes equated to a virtual urgent care visit. I will still say, when I talk to customers, the thought of being able to provide virtual primary care or a virtual specialty visit, it's somehow seen as being like less than. And I think that, in terms of, there's a demand for it. What we see in our care model, our net promoter score right now, we've been the last year around an 82, but we've actually seen a spike, I'd say, over the last quarter, where we're starting to approach 87. That's unheard of. I mean, that's really phenomenal. But I think that's an expectation that patients are coming in. They want to have a visit that's still high quality, it's connected, it's part of their health system, and it's also on their terms. And so what I have seen is when I talk about that regression towards the mean, reimbursement is still oftentimes higher when that patient is seen in person. And so there's still, especially with these financial pressures that a lot of health systems are facing, they're looking at, how do we drive that patient back in? How do we drive that patient back in? But the patient is, if given a choice, I think, especially in our target market, who's utilizing our services, is the 20 somethings to the late 40s, early 50s even. They just still appreciate that convenience. So I do think that we're just talking about, pure virtual care. We're not talking about all the buzz around AI. It's still talking about having that human connection across a video visit and being able to help answer questions in real time. So it's, I think, still needing to have that personal element. We call it, virtual care that's entirely human. Patients are still looking for that connection, and just by automating it or replacing it, I don't think that's going to be a satisfier for patients over the long run.